I did a Kaizen for manometries, we would have to purchase our patients when we put down a probe. It measures involuntary and voluntary muscle movement, so you have to kind of see if the muscles are functioning properly in the esophagus for certain patients to have certain types of hernia repairs or different types of surgeries, and then sometimes patients have conditions where they can't swallow, and so we're trying to figure out why. So the manometry part of it, you have to drink 10 sips of Gatorade, and then there was a stuff that they used to use. It was a viscous, and basically it was like, I don't know if I can say this, it was like flavored snot. So it was like cherry, grape, and banana. And it was just, I couldn't get patients to swallow it most of the time.
Yeah.
And you would get a 12 pack for $260 for the 12 pack. And I would go through anywhere between 1 and 2 packs a week. So most of the time I was spending, what's 260 plus 260, 500 some odd dollars a week on viscous for patients to swallow. So one day, couldn't get a lady to swallow, so struggling, so I ran out here and I said, somebody please go get me some applesauce. Let me see if she can swallow this. So she did beautifully, it went down perfectly, and so I called the company that the probe came from, and I said, can we use applesauce instead of this viscous? Do I have to use it? And they're like, well, no, as long as it didn't hurt the probe. And I said, no, did fine. So we switched to applesauce, so that was a savings in 2 years of almost $30,000 just in the manometry program.
And patient satisfaction.
Oh, and the patients love it. I
Yeah.
mean, it's so much easier, it goes down smoother, and so that's kind of just, and I didn't even think about implementing that, and I did that 2 years ago. And Holland calls me, she goes, didn't you switch out applesauce for something? And I was like, yeah. She goes, that's a Kaizen, Julie. And I'm like, oh, okay, well, I'll put it down.
Yeah.
But it's just something like that. That's the biggest Kaizen I've done.
Wow. Yeah.
Yeah, so it's big savings.
Yeah.
It's
And other benefits too. I mean,
yeah,
it's
the
nice
patient benefits from it. It's, applesauce throughout the hospital, so patients like it's easy for us to get a hold of. If I run out of the viscous, I would have to wait to order it or panic that I was going to be out and I had like 3 or 4 cases, and then you'd have to have overnight shipping and stuff like that, so that's another expense. So we don't have any of that expense anymore. So
That's great.
it slowly begins to make sense, like, oh gosh, just little changes can make big results. I mean, I would have never thought applesauce when not one time did I ever sit down and figure the numbers. Not one time until Holland said, can you figure those numbers out for me? And I was like, my goodness, that's huge. I mean, just something that small that's available for all of us to use. Like when we tried to implement the applesauce, she was like, make sure the company says that won't damage anything. And I was like, well, I've already took care of that.
Right.
But no, I can't say that she's ever pushed back and said, I don't think that's a good idea. Try it and see if it works. If it didn't work, we tried it. But when you figure you have a probe in your nose down into your stomach and you're trying to eat and swallow at the same time, let's make it as pleasant as possible.
Right.
Because when I first started doing it, they used salt water.
Oh.
And I'm like, why can't we just use Gatorade as something flavored?
Yeah.
So I did that too.
There's no Kaizen.
No, that cost us. Salt water was cheap. So a salt shaker,
Patient
no
satisfaction.
You know what?
Yeah, see?
Another Kaizen.
Another Kaizen. Well, keep writing them up. Keep doing them.